All right, so we're going to look at the hip joint for running. So the first thing I do is identify stance and swing phase. So I know this is running. There's my little pointer, and I'm going to say approximately 40% is stance, and the remaining 60% is the swing phase. Then I add the kinematics. So for the most part, during the stance phase, you're experiencing hip extension, and for the swing phase you are experiencing hip flexion. The reason for that hip flexion is to advance the limb. Alright, so this is the angular position data for the hip joint. Below is EMG, or myoelectric activation, for the rectus femoris in the squares, which represents hip flexors for the hip, and the hamstring muscles, which represents the hip extensors. All right, so it gets very interesting for the hip joint, because in the beginning you basically hit the ground, foot contact, so you basically put the brakes on your lower limb, and then you can, without any muscle activation, your whole upper limb would pitch forward and almost pike at the hip, right? So you'd go through an extreme hip flexion. Except that when your hip is going through extension, so you're engaging the hamstring muscle group, which are your hip extensors. So you're extending, and your hamstrings are active, so it's an extensor torque, and that is a concentric contraction. So this concentric contraction at the beginning of the hip extension phase is basically making sure your body remains upright and does not pitch forward. Then, as you continue to extend, you move into an eccentric contraction of your hip flexors. Okay, so you see your rectus femoris, which is representing your hip flexors, increases activation. It is a flexor torque, but you are extending, so that's an eccentric contraction. And this is basically setting up for the concentric contraction during the swing phase. We're going to talk about and see that anytime you have an eccentric followed by a concentric contraction, that's a very, very efficient movement pattern. So for flexion, to advance the limb, you can see an increase in your rectus femoris. So you have your hip flexors creating a flexor torque. You are flexing, so that is a concentric contraction. All right.